I can see why these doctors' offices could use this kind of help when it's that kind of a maze you got to run through for every patient just to make sure, stuff's getting paid for.
Yeah, I mean, I think of it as if you're a physician, you're seeing 20 patients in a 10-hour day and then doing like your charting at 9 o'clock at night and putting your notes in the EMR. When are you ever supposed to figure out, well, this is why Mrs. Smith's diabetes is not getting under control, and like this is what's happened to her A1C over the last like 6 months, and what's happening, like let's tweak her medication like slightly. That is how you get healthier patients. But asking a person to go do that who's working in the current healthcare system is not realistic, and it never will change unless we are doing something different. I found that our best customers are physician practices who are just like really interested in like patient care and quality, who have like internal quality programs. They're trying to like move the needle, and we can come and do it for them at no cost and actually generate some profit on the back end for it. So if the ultimate goal is, I just want better patient care, you're 100% going to get better patient care. There's like no questioning. You have more access, you have more data. We're going to improve outcomes for those patients, and you're going to get some incremental revenue out of it as well. And like one thing I realized is the traditional like health plans have a very perverse incentive to like not get people well, because it's so transient. Like if you spend money to get me well and you're Aetna, and then 2 years from now I switch jobs and I go work for you, my employer gets United or Blue Cross or whatever. It's like, man, I invested in Seth, I got him healthy, and like now my competitor is getting the benefit. So like,
right.
If it's not going to move the needle financially in the next like year or 2 years, like, I'm not going to spend all that much time on Seth unless he's like a frequent flyer ER person.
Right.
And by that point, there's very little you can really do. Like if you think about, patients who have diabetes, they've had diabetes for 30 years and they've just been like managing it and dealing with it and like letting it get worse and not really like knowing how to like do anything about it. And then all of a sudden they kind of want to try to improve their condition and don't really know where to start. That's typically like the person we're dealing with. So in like normal context, it would be someone who's like, been overweight for 30 years and now they want to go to the gym. Okay, like there's going to be a lot of stumbling blocks if they're not just going to like show up and go to the gym every single day and like change their diet and lose 100 pounds in, the next 3 months. Like if there's not somebody who's like going to help encourage them that like, yeah, it's okay to fall down and like keep going and stuff. That's one of the things we need to like keep pushing on these patients to deal with, because it's really easy to just like fall off, get lost in the system and not really like continue on your journey to better health. Yes. So the main thing that like our app is doing is, one, is it's digesting all the information, automating anything back to the patients. So sending them like reminders of things that they should be doing, pushing messages about their care plan that they need to be working on, all that type of stuff. It's also triaging all this stuff for our team. So like when a nurse comes in to work at Welby, it's like, here's my panel of 150 patients. It's automating who they need to talk to based on what their prior vital readings were, or like follow-up things for the patients. So like I said, if you don't have underlying technology, it's hard to just like do this kind of program. We're just pushing everything to the nurse. It's like, hey, call Heather, call Jeremy, call Seth. Like, this is what happened last week. This is what you need to do. It like automates all the SOAP notes for them and like records the call that they're on, generates it so the nurse doesn't have to do anything. It can push it back into the EMR. If there's like elevated readings or things, it'll just like push that data back into the EMR and like push a message to the providers. If you think about the health system, there's really kind of like three constituents. There's health plans, there's health systems, and there's pharmaceutical companies. And all three of them like do not want you healthy. Like fundamentally, it's not in their business interest to do so. I mean, sure, there's amazing people in there that want that, but like at the end of the day, like the business dynamics of those things aren't designed to get people healthy. No one gets paid when everybody's healthy. So I was just thinking maybe just coming at it from a different perspective, take what I've learned in the healthcare field and then go use more technology and like have some direct mechanism into patients, was how I ended up starting what is now, Welby. Obviously, like we've evolved And there's different things we do beyond that, but that was my initial concept of like how we could like tackle the problem of healthcare and getting people to like manage their own care a little bit better.
This has been a Shut Up production.